Hey guys, what's going on? Welcome to another video on my channel, Hairliciously. If you guys are new to the channel, please make sure to subscribe so that you guys are updated on hair loss and hair transplant topics, as well as updates on current hair loss treatments in the pipeline. Visit my website at HAIRLICIOUSLY.com to purchase our microneedling device, which is scientifically proven to stimulate hair growth, my low-level laser therapy cap, DHT blocking shampoo, conditioner, and serum, hair growth vitamins, and a few other products to help those who are losing hair. In today's video, I wanted to give you guys yet another incredible update regarding the drug Verteporfin for the treatment of alopecia. I've covered a couple of videos on Verteporfin on my channel already, and this drug to me is by far one of the most interesting ones that I have been following for the past year, mainly because of its potential to regrow back hair follicles that have actually been extracted from the back of the donor area, as well as its ability to eliminate fibrotic scar tissue. We have, shitty companies like Dr. Suji and Rogaine, Replicel, who are trying to focus on hair follicle multiplication and cloning. But up to date, there is no other company or drug that even comes close in terms of actual tangible research that can regenerate human hair follicles. So I am super stoked about the potential that Verteporfin has in regenerating hair follicles. So before I dive into the update, let me just do a quick recap on Verteporfin, what it is and what it does and how it works, and current studies that have been conducted and ongoing. Verteporfin is an FDA-approved medication that is used to treat macular degeneration, and over the past year, scientists have found that a specific population of skin fibroblasts activate expression of a protein called ingrailed-1, and this upregulates pro-fibrotic cellular programs in response to local tissue mechanics in wounds. However, when this mechanical signaling was inhibited in the cells through Verteporfin by blocking the YAP pathway, it actually encouraged wound repair without fibrosis, and surprisingly, it also was able to regenerate secondary skin elements, including hair follicles and sebaceous glands. Now, when Verteporfin was injected in the wounds of mice and pig models, the same effect actually occurred with no scarring, and it actually regrew hair, sweat glands, and other critical structures to the point where it was nearly indistinguishable from the control group. So the real question comes down to, is this going to have the same effect in human beings? And fortunately, the last update that I gave pertaining to was actually pertaining to Dr. Barghouthi, who is one of the few doctors, if not the only doctor, that is studying the effects of Verteporfin injected into FU extraction wounds. And this is actually done on human beings. So he's actually been testing it out on one of his patients and has been documenting the results across several hair loss forums, so that we can see exactly what the effects of Verteporfin has been. So let's go and take a look at the update results going well into the 3-month mark of his patient. A quick recap at 14 days post-op shows the control group at the top 2 photos, and we have the test site using 0.4 milligram Verteporfin injection. There's obviously, no new hair growth in the test site at this point, and there also appears to be kind of like a hyperpigmentation in the test site compared to the control, which is pretty interesting. The next image are at 30 days post-injection using 0.4 and 0.32 milligram Verteporfin. Both control groups still have that whitish texture FUE scar, and the area appears completely flat, while the test groups that had both Verteporfin injections definitely has improved skin texture, and there's kind of like this ruggedness that appear a bit more normal skinned compared to the control. You can't really see any of the white scars on the test group, which is pretty interesting to see how inhibition of the ingrailed-1 gene is really remodeling the skin at this point. And then at 55 days post-injection and control, the image at the top left in the dead center is where the doctor extracted a hair graft, which is then magnified on the bottom left photo to show that for the control group, there still is that whitish FUE scar. However, take a look at the top right photo, which was after using 0.4 milligram Verteporfin injection. And zooming in, we can definitely see a single hair graft protruding exactly in the vicinity from where the FU extraction was. And this to me is extremely crazy because we all know that once a graft is extracted via FUE from the back of the donor area, there is no way for it to regenerate. And this is exactly the limitation when it comes to a hair transplant, because we only have so many finite grafts that can be extracted for implantation. So if this truly is a new hair follicle that has regenerated even after an FU extraction, where basically all the organs of a fully functioning hair follicle are present, this is going to be a huge breakthrough for the hair loss community because we now have something that may potentially be able to offer us, hair regeneration capability for more hair grafts that can be used towards hair transplantation. And even if you don't use these grafts that are regenerating, you won't have to worry about things like the donor area being over harvested because the hairs are actually being regenerated. This next image is with 0.32 milligram verteporfin and the control. And even here in the photo on the right column, you guys can see a fine singular graft emerging from the FU extraction test site. The hair diameter isn't as thick compared to the one from the 0.4 milligram test group, but it's definitely a hair graft that is sprouting out, which is just amazing. And then finally, another area treatment with 0.32 milligram verteporfin also shows a thin hair protruding directly from the discolored extraction area where the FU scar is. So overall, in my opinion, this is definite proof that the hairs have indeed regenerated from FU extraction sites that were injected with various doses of verteporfin. Now, the last set of photos provided by Dr. Barghouthi is at 84 days post-injection, which is nearly 3 months since their last respective injections. I will have to note that these extraction sites are not necessarily the same sites shown in previous updates, since it's really difficult to track specific sites without using a tattoo mark. Nevertheless, at 84 days post-injection using 0.24 milligram verteporfin, you can clearly see the top left and right images now showing not just one, but 2 visible small terminal hairs that are emerging from the FU extraction test site around the other hairs, which are noticeably longer, is just truly remarkable. The control images on the bottom left and right still show an FU extraction area and scarring that is void of any hair as expected. And then moving over to the 0.32 milligram verteporfin, we can still continue to see that the test area has visible hairs growing out from the FU scar, while the bottom control group still has that visible white pinkish skin texture without any hairs growing out. It's very interesting to see how this is just all unfolding. And then finally, at 0.4 milligram verteporfin, the top photos show a single graft emerging in the same direction as the other native hairs, directly from the center of an extraction site. The control group, once again, does not have any hairs growing in from the FU extracted region. And even previously, all the control groups did not have any telogen hairs coming out, which confirms that these are indeed new hairs that have regenerated from verteporfin. And now that we have proof that verteporfin indeed works in regenerating new hair follicles on FU extracted sites, this is just truly incredible news. This is by far the biggest step that I've personally witnessed in the hair loss community. There definitely needs to be a full blown out research on verteporfin now to look into the possibilities and just all these different variables in terms of efficacy and hair growth from, things like different dosages, different FUE punch sizes, injection frequencies, etc. And at the same time, there's also a lot of questions that are still going to remain unanswered and will need further investigating and just time. Are these hairs able to really stay terminal, as well as be resistant to DHT, as in the case of the hair follicles that are taken from the back of the scalp? Are we able to extract these regenerated hair follicles for hair transplantation? Are they going to take on the same characteristics as the prior native hairs that were extracted? For example, if a multi-graft containing 4 hairs were removed, is the new regenerated hair follicle also going to be a 4-hair multi-graft? So I am confident that with more time, there's going to be better potential for the wounds to not only remodel, but also for the hairs on the test sites to grow out stronger and thicker. And based on the verteporfin pig study, elasticity was increasing after 3 to 4 months. So if the same case applies, we should continue to see regenerative remodeling and improvement at around 3 months and up. And seeing hair growth using verteporfin on the FU extraction sites kind of reminds me when I started noticing hair growth around the 3 to 4 month post hair transplant. And I know it's not exactly the same concept, but the initial hairs that were growing out were very thin and fragile, just like the regenerated hair follicles after verteporfin injection. But over time, these hairs that were implanted thickened up and they matched to that of the donor hair from the back of the scalp. And I'm cautiously optimistic at this point because it's still too early, but that the hairs treated with verteporfin will also go through the same phases of gradual thickening. But like I said, it's going to take time to tell. Anyway, huge props to Dr. Barghouthi for leading this experiment. And I am definitely looking forward to the next step of updates. Let me know in the comments what you guys think of Verteporfin and its potential to regenerate new hair follicles. I will definitely keep you guys updated on the next update, which is supposed to take place about 4 weeks later. So kind of like around the 4.5 month mark. Hopefully we will see some hairs thickening up and just becoming terminal. But until then, thanks for your support. Make sure to smash the like button, and I will talk to you guys in my next video. Take care.